The respiratory system is one of the most essential systems of the human body, responsible for breathing and the exchange of gases that sustain life. Every cell in the body needs oxygen to produce energy, and the respiratory system ensures a continuous supply of oxygen while removing carbon dioxide, a waste product of metabolism. From the moment we inhale to the final exchange of gases in the lungs, this system works tirelessly to keep the body functioning. Breathing begins when air enters the body through the nose or mouth. The nasal cavity plays an important role by filtering dust and microorganisms, warming the air, and adding moisture. From here, air passes through the pharynx and larynx, and then moves down the trachea. The trachea divides into two bronchi, one leading to each lung. Inside the lungs, the bronchi further branch into smaller bronchioles, finally ending in millions of tiny air sacs called alveoli. The alveoli are the most important structures for gas exchange. Their walls are extremely thin and are surrounded by a dense network of capillaries. Then, oxygen-rich air reaches the alveoli. Oxygen diffuses across the alveolar walls into the blood due to a concentration gradient. At the same time, carbon dioxide diffuses from the blood into the alveoli to be exhaled. This exchange of gases ensures that oxygen is delivered to body tissues and carbon dioxide is removed efficiently. The movement of air in and out of the lungs is known as breathing and occurs in two phases, inhalation and exhalation. During inhalation, the diaphragm contracts and moves downward, while the external intercostal muscles lift the ribs upward and outward. These movements increase the volume of the chest cavity, reducing pressure inside the lungs and allowing air to flow in. During exhalation, the diaphragm relaxes and moves upward, and the ribs move downward. This decreases chest cavity volume, increases lung pressure, and pushes air out. At rest, exhalation is usually passive, while during exercise it becomes active. Breathing is not random but is carefully controlled by the nervous system. Specialized respiratory centers located in the brain regulate the rhythm and depth of breathing. These centers respond mainly to changes in carbon dioxide levels in the blood. When carbon dioxide levels rise, breathing becomes faster and deeper to remove the excess gas. When levels fall, breathing slows down. This automatic control allows breathing to adapt continuously to the body's needs during rest, exercise, sleep, or stress. Lung volumes and capacities play an important role in breathing efficiency. Tidal volume refers to the normal amount of air breathed in and out during quiet breathing. Inspiratory and expiratory reserve volumes represent the extra air that can be inhaled or exhaled during deep breathing. Residual volume is the air that remains in the lungs, even after forceful exhalation, preventing lung collapse. Together, these volumes form lung capacities, such as vital capacity and total lung capacity, which indicates overall lung health and performance. Several disorders can affect the respiratory system and disturb normal breathing. Asthma is a chronic condition in which the airways become inflamed and narrowed, making breathing difficult, especially during exposure to triggers like dust or pollution. Bronchitis involves inflammation and mucus buildup in the bronchi, leading to coughing and reduced airflow. Pneumonia is a lung infection where alveoli fill with fluid, severely reducing oxygen exchange. These conditions interfere with respiration and can become serious if not treated properly. Lifestyle choices have a strong impact on respiratory health. Smoking and air pollution introduce harmful chemicals into the lungs that damage airways, destroy protective cilia, and reduce oxygen exchange in the alveoli. Over time, this leads to reduced lung capacity, breathlessness, and chronic respiratory diseases. Avoiding smoking and minimizing exposure to polluted air are among the most effective ways to protect lung health. In addition, regular physical activity and breathing exercises help keep the lungs strong and efficient. Deep breathing exercises expand the lungs fully, strengthen respiratory muscles, and improve oxygen intake. Practicing these exercises regularly supports lung function and overall well-being. In conclusion, the respiratory system is a complex, yet beautifully coordinated system that enables breathing, gas exchange, and adaptation to the body's needs. From air entry and alveolar exchange to nervous control and lung volumes, every component plays a vital role. Understanding respiratory disorders and adopting healthy habits such as avoiding smoking and practicing breathing exercises are essential for maintaining healthy lungs and a better quality of life.